Due to the new National Patient Safety Alerts document and the updated publication in 2023 of the Medicines and Healthcare Products Regulatory Agency Guidance on Managing and Using Bed Rail Safety document, today I am going to be demonstrating the correct way to attach our compatible side and grab rails to the Solite Pro Bedframe for use with the adult patient. When the side rails and specified mattress are correctly fitted onto the bed frame, ensure the distance between the top of the uncompressed mattress and the top of the side rail when raised is greater than or equal to 220 millimeters. Select two brackets, one offset bracket and one standard bracket. The brackets are handed and must be used on a specific side of the bed. Note the correct orientation of the arrow and release the plungers on the brackets during installation. Hook one of the offset brackets onto the appropriate side of the mattress platform at the head end of the bed. Ensure the correct bracket is used by checking that the arrow is pointing upwards when the release plunger is facing away from the headboard. Ensure that the metal clamp on the offset bracket is located 90 millimeters plus or minus 5 millimeters each way from the headboard. If the side rails are not being fitted to the Solite range of beds, follow the instructions in step 8 for the correct bracket and side rail positioning. Fully tighten the offset bracket hand wheel to secure the offset bracket to the head end mattress platform side tube. Hook one of the standard brackets onto the foot end of the mattress platform. Ensure the correct bracket is used by checking that the arrow is pointing upwards when the release plunger is facing away from the footboard. Do not fully tighten the hand wheel on the standard bracket as yet. Pull the release plungers on each bracket and slide the side rail into the brackets. Ensure the magnolia half of the side rail is positioned at the head end of the bed. Raise the side rail until it latches into the raised position at both the head and the foot end of the bed frame. With the foot end bracket loosened, adjust the length of the side rail as desired. It is important that the gaps between the side rail and the bed ends are critical. The gap between the side rail and the head end must be less than 60 millimeters, and the gap between the side rail and the foot end must be greater than 318 millimeters. Ensure the overextension label is not visible on the inner section of the side rail. If the label is visible, the side rail must be retracted until the label is no longer visible. Fully tighten the foot end bracket hand wheel to secure the side rail in position, ensuring the bracket is not fouling with any part of the bed frame, such as welds or fixings. Repeat the procedure with the remaining side rail on the other side of the bed frame. To lower the side rail from the raised position, pull out the release plunger on each bracket and lower the side rail down until it reaches its lowest position. Do not drop the side rails when lowering. To raise the side rail from the lowered position, lift the side rail up until the release plunger engages and the side rail locks into position. For side rails fitted to height adjustable beds, Drive to Vilbis Healthcare recommends that for comfortable ingress and egress, the bed platform is raised until the top of the side rail is lower than the top of the mattress. When raising and lowering the side rails, ensure they are free from limbs to ensure there is no risk of injury or entrapment. Ensure the side rails are correctly locked into place at both ends at all times when in a raised position, again due to risk of injury or entrapment. When lowering the side rail, do not let go of the rail until it is fully down. There is a risk of product damage and possible user injury if the side rail is dropped. Bed rails are used extensively in community, acute and home care environments to reduce the risk of bed occupants falling out of bed and injuring themselves. They are not designed or intended to limit the freedom of people by preventing them from intentionally leaving their beds, nor are they intended to restrain people whose condition disposes them to erratic, repetitive or violent movement.